I'm Mark, I'm 38 years old, and I'm going to tell you about the most terrifying experience of my life. I had a hair transplant, a simple cosmetic procedure. Thousands of people get it done every day. I thought it was safe. I thought it was easy, but it turned out to be the biggest mistake of my life. 4 days later, I woke up in the hospital. My head was completely wrapped in bandages, tightly covered, and the doctor said, "You lost 60% of your scalp. It's necrotizing fasciitis, a flesh-eating bacteria. It's very rare, very aggressive. You're lucky to be alive," but I didn't feel lucky, because when I looked in the mirror, I didn't recognize myself. I went in for more hair, and now I have none. No scalp, no hair, just scars, just grafts, just regret. This is the story of how a cosmetic procedure turned into a nightmare, how my life changed completely in just 4 days, and why nothing will ever be the same again. It all started 6 months ago. I was looking in the mirror and I noticed my hair was thinning. The crown was getting sparse, the front was receding, and even though I was 38, I still felt young. But the man staring back at me looked old, tired. My wife, Jessica, said, "You're handsome. Hair doesn't matter." But it mattered to me. My confidence was gone. In meetings, I felt insecure. In photos, I hated how I looked. And I thought, I have to do something. So I started researching. I searched for hair transplant clinics online, looked at before and after photos, and they were shocking. Completely bald men now had thick, full hair. They looked younger, happier. I thought, I can do that too. I can change. I read the reviews. Most were positive. A few mentioned pain, swelling, itching, but nothing serious. No one died. No one had a major complication. It looked safe. It looked simple. I looked at clinics in Istanbul. Turkey is famous for hair transplants, the best doctors, the newest techniques, amazing results. But the prices were high, $3,000–4,000. I thought maybe I can find somewhere cheaper. Another country, same quality, less money. Then I found one, a clinic in Mexico, in Tijuana, close to the US border, easy to reach. And the price was incredibly low. $1,500, half the cost. Tempting. The reviews were good. 4 stars, hundreds of happy clients. And I thought, why not? Hair transplant is hair transplant, same procedure, same technique, and I'll save money. Maybe even take a vacation. So I made the decision. I booked it. And now, I wish I had listened to that little voice inside. I wish I had gone to Istanbul. I wish I had spent a little more, because the cheap option cost me everything. When I arrived at the clinic, my first impression was doubt. The building looked old. The paint was peeling off the walls. A woman sat at the reception desk. There were forms in front of me, English forms, but poorly translated. Some sentences made no sense. I thought maybe this was a mistake. Maybe I shouldn't be here, but I couldn't turn back. I had already paid, bought the plane ticket, booked the hotel. So I went on. They took me to a room, small, not sterile, not clean looking. Then the doctor came in, a young man, maybe in his 30s. He spoke English, but with a heavy accent. It was hard to understand him. He looked at my scalp and said, "Yes, we can do it." 3,000 follicles, 6 hours. And we started, just like that. No blood test, no allergy test, nothing. Then came the needles. Into my scalp, local anesthesia. It hurt, a lot. 10 needles, 20. I lost count. Eventually, the numbness set in. My head went completely numb. They told me to lie face down on the table, my head in a hole, my neck already aching. But I stayed still. I was ready to wait 6 hours. I heard sounds, machines, voices speaking Spanish. I didn't understand a word. I could feel pressure on my scalp, pulling, scraping, but no pain, just discomfort. 3 hours passed, 4, 5, and then it was done. The doctor said, "All finished. Looks great. 3,000 follicles. You'll see results in 6 months." I looked in the mirror. My head was bandaged, partly covered, and I saw the dots. Thousands of tiny red dots. Blood spots. My forehead was swollen. "Normal," the doctor said. 2-3 days, it goes away. He gave me painkillers and antibiotics, white pills in an unmarked box, Spanish label. I didn't understand what they were, but I took them, put them in my pocket, paid $1,500 in cash, and left. I went back to the hotel, thinking it was all over. That night at the hotel, there was pain, a throbbing pain, like a heartbeat inside my head. I took one of the pills they gave me, a yellow one, swallowed it with water, and went to sleep. I actually slept well. When I woke up the next morning, the swelling had gotten worse. My forehead was swollen, my eyes were puffy, almost closed, especially the right one, half shut. I went to the bathroom, looked in the mirror, and froze. Is that me? I thought. My face was unrecognizable, but the doctor had said it was normal. 2 or 3 days, it would go away. Gravity, he said. The fluids move down. So I waited. I just waited. I didn't eat breakfast, no appetite. I just drank water, stayed in the room, watched TV to distract myself. Around noon, I called Jessica. She asked how I was, and I said I was fine. I told her there was swelling, but that it was normal. I didn't want to scare her. She had already told me not to go, told me to do it locally. I hadn't listened. Now I regretted it, but I didn't say that. I wanted to sound strong. On the second day I flew back to the US, I left early in the morning, went to the airport, got on the plane. People stared. They looked at my face. It was still swollen, my eyes barely open. I felt embarrassed. I put on a hat, sunglasses, tried to hide. The flight was 5 hours. My head hurt from the cabin pressure. The throbbing was worse. I went to the restroom, checked the bandages. There was some blood, small stains, red dots. I told myself it was normal. Fresh wounds can bleed. When I got home that evening, Jessica was waiting at the door. She saw me and said, "Oh my God, what happened to you? Your face is so swollen. Your eyes are almost closed." She wanted to touch me, but I pulled back. I was afraid it would hurt. I told her it was normal, that the doctor said it would go down in 2 or 3 days. "It's fine," I said. "In 6 months, I'll have hair." She looked skeptical but didn't argue. "Come on," she said. "Rest." Lie down that night, I went to bed early. I was exhausted. Long trip, stress, pain. I fell asleep but woke up around midnight. I was burning. My whole body was on fire. I was drenched in sweat. The sheets were soaked. I grabbed the thermometer, 38.2 degrees Celsius, high. Maybe it's just the flu, I thought. Maybe I caught something on the plane. I took another painkiller and one of the antibiotics from Mexico, the white pills with Spanish labels, and went back to sleep. On the third day, I woke up feeling slightly better. The swelling was down a little. My eyes opened more. My forehead was still puffy, but I felt relieved. It's healing, I told myself. I took a shower, carefully, kept water away from my scalp, checked the bandages, didn't change them. The doctor said 5 days, but I noticed redness along the edges, pink, inflamed. Normal healing, I thought. By afternoon, the pain changed. It wasn't throbbing anymore. It was sharp, stabbing, like someone was cutting into my scalp from the inside. I couldn't take it. I took 2 painkillers, double the dose. At dinner, I had no appetite. Jessica cooked pasta, my favorite, but I barely ate. Everything tasted like nothing. I felt nauseous. Jessica looked at me and said, "Are you sure you're okay? Maybe we should see a doctor." I refused. Cosmetic procedures weren't covered by insurance, and I didn't want to spend hundreds on a consultation. "Tomorrow," I said. "If it's worse tomorrow, we'll go." That night, my fever spiked, 38.7 degrees Celsius. I was shaking uncontrollably, teeth chattering. I pulled 2 blankets over myself, but I couldn't stop shivering. Jessica woke up, saw me trembling, terrified. "Tomorrow we're going to the doctor," she said. No arguments. And I agreed, because by then I was scared too. Something was wrong. Very wrong. The next morning, the pain was different, unbearable, a burning pain like acid on my skin. I touched the bandages. They were wet. I didn't know if it was sweat or blood. I went to the bathroom and decided, I'm taking these off. I needed to see. I peeled them back slowly, carefully. They were stuck to the wound, glued by fluid. The moment I did, the smell hit me, a foul, rotting smell, like garbage left in the sun. Infection. I looked in the mirror and froze. My scalp was red. Dark red, almost purple in some areas, with patches of black. The tissue looked dead. Thick yellow-green fluid oozed from tiny holes, mixed with blood. It wasn't healing. It was decaying. And in that moment I knew this wasn't normal. This was bad. Really bad. And panic hit me like lightning. I called out to Jessica from the bathroom, my voice full of panic. "Come here!" I shouted. "Come here now!" She ran in, saw my head, and the color drained from her face. "Oh my God!" she said. "What is that? That looks really bad." She tried to touch me, but I pulled away, afraid it would hurt. "We need to go to the hospital," I said. "Now." We dressed quickly, got in the car, and drove to the nearest ER. It took about 10 minutes. Jessica drove fast, ran a red light. "It doesn't matter," she said. "I have to get you there." We ran into the emergency room. The automatic doors opened, and I went straight to the reception desk. I showed them my head. I had already taken the bandages off. The open wounds were visible. The woman at the desk looked up. Her eyes widened. She pressed a button, an emergency call button, and within seconds a nurse came running. She looked at my scalp closely and asked, "What happened?" "Hair transplant," I said. 4 days ago. In Mexico, the nurse said, "Come with me, right now." No waiting. Straight into a trauma room. I lay down on the exam table. She checked my vitals. Blood pressure, heart rate, temperature, oxygen. My temperature was 39.1 degrees Celsius, pulse 105, blood pressure 145/90. Too high. "Doctor's coming," she said. "Don't move," and hurried out. Jessica held my hand. Her hand was shaking. She was terrified. So was I. 5 minutes later, the doctor came in, a young woman, maybe in her 30s. Her badge read Dr. Sarah Chen. She looked at my head closely. Her face changed as she examined me. The polite smile faded, replaced by concern, by fear. "When did this happen?" "Where?" she asked. "How are you feeling?" I told her everything. 4 days ago. Mexico, cheap clinic, $1,500. Fever started on the 3rd day. Pain worse every day. Today the smell, today the discharge. Dr. Chen nodded, took notes and said, "I need to examine this. It may hurt, but I have to know how deep it goes." She put on gloves, a mask, leaned closer, and pressed gently on the wound. I screamed. The pain shot through my skull like fire. It wasn't skin pain, it was bone pain, nerve pain, deep pain. "I'm sorry," she said softly. "I know it hurts. I have to check the depth," she pressed again. On another spot. I cried. Tears came down my face. I couldn't stop them. It felt like my head was on fire. Dr. Chen stepped back. "This is an infection," she said. "A serious one. Possibly very serious. The tissue may be necrotic. Dying. I suspect necrotizing infection. We need tests, blood work, wound culture, imaging. Maybe a CT or MRI to see if it's spreading to the brain." The moment I heard the word brain, I froze. "What do you mean, brain?" I asked. "It's just skin, right?" "Just the scalp," she didn't answer right away. Nurses came in and drew blood. 2 vials, then 3, then 4. Purple caps, red caps. They also swabbed the wound, thick yellow fluid collected on the cotton tip. "We're sending this to the lab," they said. "Results in about an hour or 2. I lay there, waiting. They hooked me up to IV fluids, started broad-spectrum antibiotics, gave me a strong painkiller. Morphine, maybe. It dulled the pain, numbed everything. Jessica sat beside me, silent, holding my hand. 2 hours later, Dr. Chen came back. This time with another doctor, an older man with grey hair and sharp eyes. He looked serious, like a surgeon. They both sat down across from me. "Mr. Collins," Dr. Chen said quietly, "we've reviewed your results. They're not good." She went on, "Your blood work shows severe infection, extremely high white count, high CRP, high ESR. Your body is fighting a massive bacterial invasion. The wound culture came back positive for Streptococcus pyogenes, group A strep. It's what we call a flesh-eating bacteria, necrotizing fasciitis. It spreads fast, very fast. It can destroy tissue at a rate of about 1 centimeter per hour, 5 to 10 centimeters per day. And it's been 4 days." The older doctor spoke next. "I'm Dr. James Rodriguez," he said, "plastic and reconstructive surgeon. Mr. Collins, we need to operate immediately, today, now. We have to remove all the infected tissue. If we don't, the bacteria will spread to your brain, to your bloodstream, and you'll go septic. Your organs will fail, you will die." He said it clearly. "No sugarcoating. You will die." I froze. The words echoed in my head. Flesh-eating bacteria, emergency surgery, spreading to the brain. Death. Jessica started crying. She held my hand so tightly it hurt. I asked, "How much will you have to take?" "How much of my scalp?" Dr. Rodriguez said, "We don't know yet. We'll see during surgery. We'll remove everything infected, down to healthy tissue. It could be half your scalp, maybe 60%, maybe more. It depends how far it's gone, but we have no choice. If we don't remove it, you will die." Jessica asked, "What are the risks?" Dr. Rodriguez answered, "There are always risks: anesthesia, bleeding, secondary infection. But not operating is 100% fatal. Operating gives you a 90% chance of survival. The choice is clear. I signed the papers, the consent form, the surgical release, the risk acknowledgement." My hand was trembling, but I signed. Jessica signed too. They said, "We'll prep you now." Surgery in 1 hour. Then they left us alone. Jessica leaned on me, crying. "You have to come back," she said. "Promise me you'll come back." I told her I would. "I'll fight," I said. "I'll come back." But inside I was terrified. Deep down, I thought maybe this is it. Maybe I won't wake up again. The first thing I felt when I woke up was pain. Deep, burning pain all over my head. My eyes opened slowly, heavy, and the first thing I saw was a white ceiling, a hospital ceiling. I heard beeping sounds, rhythmic, machines around me, footsteps, and then I saw Jessica. She was sitting beside me, holding my hand, tears running down her face. When she saw my eyes open, she cried harder. "You're alive," she said. "You came back." Then the surgeon came in, the one who had operated on me. He looked exhausted. He sat down and said, "The surgery lasted 8 hours. It was bad, really bad. The infection had spread much further than we thought. We had to remove about 60% of your scalp, the back, the sides, everything down to healthy tissue. We cleaned it out completely, started you on antibiotics, and placed a temporary graft. We took skin from your leg to cover the exposed areas. It's not permanent. There will be more surgeries later, reconstruction surgeries, but for now, you're alive. The infection is gone. You're lucky, Mark. If you had waited 1 more day, you probably wouldn't have made it." I couldn't look at myself. The doctor asked, "Do you want to see?" And I said, "No, not yet. I wasn't ready." A week later, I had no choice. The nurses had to change the dressings. They carefully removed the bandages, and I saw my reflection for the first time. My head was wrapped in layers of white gauze, but there were exposed areas, stitched lines, raw red patches, pieces of grafted skin. It looked uneven, foreign, monstrous. I stared and thought, "That's not me. That can't be me." Jessica was standing beside me. She said, "You're still you. You're still my husband. I still love you," but I could see it in her eyes, the pain, the shock, and I hated myself. I hated that I'd done this. All for hair, I thought. For hair, I destroyed myself. How stupid could I be? I stayed in the hospital for 2 weeks. They gave me intravenous antibiotics, checked me 3 times a day to make sure the infection hadn't returned, and it didn't. The infection was gone, My body was clean, but the wounds wouldn't close. The grafts weren't fully attaching, my body was rejecting them, so they had to operate again. In the second surgery, they took skin from my back, my own tissue, and placed it on my scalp, a new graft. This time, a permanent one. 4 weeks later, I finally went home. Jessica took care of me every day. She changed my dressings, gave me my medication, cleaned the wounds. I mostly sat at home, not working, not seeing anyone. I couldn't. I was ashamed. Deeply ashamed. I wore a hat all the time outside, of course, but even inside sometimes. I couldn't look in the mirror. I didn't want to see what I had become. 3 months later came the third surgery, plastic reconstruction, skin stretching, scar reduction. 4 months later, the fourth, more grafts, more corrections. Now 5 months later, I'm still healing. I still have 2, maybe 3 more surgeries ahead. The doctor told me, "You'll never look the same. The hair won't grow back in those areas. The skin was too damaged. The follicles are dead," and I accepted it. I finally accepted it. I'll live without hair. I'll live with scars. But I'll live. And that's what matters. I'm still here. Looking back now, there's so much I would have done differently. I would have gone to Istanbul, chosen a proper clinic, paid more because health matters. Cheap isn't always good. Sometimes cheap becomes very expensive. I later found out that the clinic in Mexico was shut down, closed by the health authorities. Poor hygiene, multiple infections, several patients hospitalized. I wasn't the only one. Others got sick too. One man even died the same infection that almost killed me. So yes, I'm lucky. I'm alive. My arms, my legs, my mind, all still here. I just don't have my hair anymore. I just have scars. Jessica is still with me. She never left. She takes care of me every day, supports me, loves me despite everything, and I'm so grateful for her. Truly grateful. Our kids are little 4 and 6. They don't really understand. They ask, "What happened to Daddy?" And I say, "Daddy had an accident, but he's getting better." Though, honestly, I don't know how much better I'll get. Maybe 70%, maybe 80, but never 100. I've started going back to work, back to the office. People look at the hat, at the scars under it, but they don't ask. I can see the curiosity in their eyes. Sometimes I tell them anyway. "I had a hair transplant," I say. "It went wrong. Really wrong." They're shocked, they're sorry, and I tell them, "Be careful. Do your research. Don't choose what's cheap. Your health is priceless.